Hello, good afternoon. I'm Jason Marzat, Director of the Atlantic Council's Adrian Arch Latin America Center. First, I hope everyone watching is staying healthy and staying home. And I want to thank you all for joining us for this very timely virtual event titled Ambassador Foreign Minister Video Conference, Latin America's Response to COVID-19. We regularly host rapid reaction teleconferences at the Adrian Arch Latin America Center. But this is the first all virtual video event that we convene at the center. While you watch the event, please tweet using the hashtag AC coronavirus and also tweet using the handle at ACLATAM. I want to first start off by thanking our four speakers for joining us today. Foreign Minister of El Salvador, Alexander Hill, Chilean Ambassador to the United States, Alfonso Silva, Costa Rican Ambassador to the United States, Fernando Yorca, and Colombian Ambassador to the United States, Francisco Santos. Foreign Minister, ambassadors, thank you very much for joining us and taking time out to have this very. I want to thank you also I want to also let you know that our thoughts are with each of you and each of your countries at this critical time. And that you can count on the Adrian Arch Latin America Center as a resource and a partner in helping to think through solutions. Among our many guests, you can't see all of our guests, but among our I'd like to acknowledge Adrian Arch, the Atlantic Council's Executive Vice Chair and founder of our Adrian Arch Latin America Center and the Adrian Arch Rockefeller Foundation Resilience Center. Thanks, Adrian, for joining. Here at the Adrian Arch Latin America Center, the Atlantic Council, we have swiftly adapted to the new reality we're in. And through a virtual format, we will continue to produce and provide insightful analyses and recommendations on transformational and pressing issues facing the world and especially Latin America. Without a doubt, coronavirus is one of those issues. And this will be the first of other virtual convenings and written analyses to expect from the Adrian Arch Latin America Center. I also encourage everyone joining us to subscribe to the Atlantic Council's global daily newsletter to receive updates about the policy response and the implications of COVID-19 across the world. As of this morning, according to the Pan American Health Organization and also Johns Hopkins University Center for Systems Science and Engineering, there are over 5,600 cases confirmed in Latin America and the Caribbean, which is unfortunately nearly doubling the count from Friday. And Friday doubled the count that we saw the previous Wednesday, and previous Wednesday doubled the count from Monday. Among those cases, the most cases have been reported in Brazil with over 1,600, but relevant to today's call, Chile registers over 700 cases, Colombia, Ambassador, I believe, over 200, and Costa Rica, Ambassador, I believe, about 100, 130, and El Salvador has a few cases thus far. And as of today, there are 16 countries that have registered nearly 70 deaths across the region, and our hearts go to everybody across the region who has suffered, and frankly, across the United States and across the world. Governments in the region have taken important countermeasures against the multidimensional repercussions of coronavirus. General restrictions on mobility and public space are increasingly common in the region, among other measures to contain the spread of the disease. Borders are closed, ports of entry restricted. As well, economically, initial steps have been taken to alleviate the burden of the halts caused by quarantines and the virus. We will use the next hour to provide understanding and share ideas on how El Salvador, Colombia, Chile, and Costa Rica are taking steps to contain coronavirus. We could not convene a more prominent high-level panel and friends of our center to understand firsthand how Latin American governments are approaching this colossal public health and social challenge. I'd like to begin by welcoming Minister Alexander Hill, the Foreign Affairs Minister of El Salvador. Minister Hill was sworn in June 2019. And before joining President Bukele's cabinet, she served in the OAS's Inter-American Drug Abuse Control Commission, first as a specialist and then as director for demand reduction. Welcome, Minister Hill. We are also joined by Chilean Ambassador Alfonso Silva, Costa Rican Ambassador Fernando Yorca, and Colombian Ambassador Francisco Santos. Ambassador Alfonso Silva presented his credentials in September 2018. I believe Ambassador Silva, just a few minutes before Ambassador Yorca and Ambassador Santos, if I have the timing correct, on that day. Ambassador Silva is a career diplomat and has held prominent positions in the Chilean Ministry of Foreign Affairs and abroad. And prior to being designated in Washington, he served as Undersecretary of Foreign Affairs. Ambassador Yorka serves as Costa Rica's ambassador to the United States as well since September 2018. He previously held prominent positions in major transnational organizations as a health policy advisor, a medical and research manager, and a primary care medical practitioner in Spain and in Costa Rica. In 2014, he was appointed by former President Guillermo Solis as the Deputy Minister of Health, shortly thereafter becoming the Minister and the Steward of the Health, Nutrition, and Sports sector in Costa Rica. So Ambassador Yorka, you will be getting some of the difficult health questions there. And Ambassador Francisco Santos, Ambassador Santos, it's great to have you with us. Ambassador Santos served as Vice President in 2 presidential terms, alongside former President, Colombian President, and now current Senator Álvaro Uribe. He was also a candidate for mayor of Bogota in 2015, and prior to being designated to the embassy in Washington, he served as a national chief of debate for the Centro Democrático Party. All 3 ambassadors, it's a real pleasure to have you, and I really look forward to this conversation. Throughout the event today, we encourage you to interact with us by submitting questions in the chat section of the Zoom interface. You can also submit questions over Twitter using the hashtag #ACCoronavirus. We'll be taking questions at the end, but we'll also be monitoring questions as they come in. So we might bring in your questions throughout the actual discussion. What we're going to do now is provide some initial thoughts before we start with the broader panel discussion. I'd like to invite Minister Hill to provide some opening framing commentary before launching the discussion. Minister Hill, the floor is yours.
Yes, good morning to everyone. Well, good afternoon, Washington, D.C. I am extremely pleased and thank you to the Atlantic Council for taking us into account in this challenge in this discussion. Please could not, as a country, be prouder than President Bukele. I mean, we have to understand where he comes from. When he won the election, he held the hope of almost 7 million Salvadorans on his shoulders. And he had to change. I mean, the country was screaming for change. And in this situation, in which I quote him, which has been probably the biggest challenge he's ever faced, he changed our paradigms. I mean, we are reactive societies. I mean, we wait until we have the problem, in front of our face, and then we start to find remedies. His goal was to impact and protect the health of all our people, from illness and disease. So he changed the paradigm of reactive measures to extreme preventive measures. He was, at the beginning, he was criticized when he took drastic containment measures to prevent the spread of COVID-19. But now the world is applauding him and us. And we have done everything that is in our hands. Our cabinet working 24/7 from all fronts to try to contain this virus. I mean, all of you know that we are a vulnerable country. We have a precarious health system, and if this hits us, it's going to be lethal for our country. So he really took measures way. Hold on just a second, please. Hello?
Yeah, please go ahead.
Am I there?
Yes, please continue. Minister Hill?
Hello?
Yes, we can hear you. Yes, please continue.
Okay, so the president, decided, and then he was right to take extreme measures. He on December 1st, just when the outbreak of coronavirus was first notified in Wuhan, he activated the enlarged health cabinet which included representatives of all of our ministers. So we started analyzing the phenomenon. We started reading daily to see how it was behaving. Obviously, with the presence of the representative of the World Health Organization, Pan American Health Organization, and following and adapting every single protocol that was dictated by them during that period. Then on January 30th, the WHO declared an international emergency, and the President Bukele on that same day suspended flights with people from the People's Republics of China. And on January 31st, he issued a special prohibition on the entry to El Salvador of the people that had recently been in that country. Then he issued another special prohibition to the entry of El Salvador for people from South Korea and Italy and Iran, and we were highly criticized by those measures. But as President Bukele said, the life of one human being is worth every single sacrifice, be economic, be criticism, be any other reprehensions for that matter.
Mr. Hill, I want to bring in the ambassadors on the phone call and bring in some of the other country responses, but very important discussion on the extreme preventive measures that El Salvador has taken, and clear President Bukele has prioritized the coronavirus
right.
From the get-go. Ambassador Santos, I want to turn to you. Over the last 48 hours, Colombia is one of a number of countries that have put in place general quarantines. I believe as of yesterday, or as of today, actually flights are now suspended into Colombia. Domestic flights will be suspended soon. Ambassador Santos, can you start off first by describing the overall approach that President Duque is taking and specific actions to prevent or contain the spread?
Let me talk about something that I think is a problem that we're going to see in the future, and that's institutionality. Nobody was prepared for what is happening, and I think institutionality, especially in countries that are so decentralized like Colombia, has created at first some conflicts of competences. So majors were saying we want to do this. They didn't have the authorities, etc., and that's something that created some confusion and created some problems. And I think that's something that we're going to have to fix in the near future, where decision making, even though it's a federal country or a decentralized country, has to become centralized, because you need to take care of procurement, you need to take care of food. There's so many variables to take into account in decisions like that if one city makes one decision and the next one doesn't, you don't fix the problem. So I wanted to just talk about this issue that it's for the future, but it's important. Thank God in Colombia that was solved through political dialogue, but I think institutionally there's a need of emergency measures that for an epidemic like this creates a new challenge and creates a different way of governing during this period. Second, undoubtedly this is a health issue, and so we're learning from mistakes that others did. We're learning from successes. So that's why with only 277 cases and 3 people dead, even though we still have a restriction on health kits, etc., because there weren't too many, President Duque has decided to quarantine the whole country for 3 weeks, which is sort of the timing and the time that experts have said it's important, and it's where you can really flatten the curve and don't overburden your health services. Second, we have decided to in that quarantine also to fund special programs for those who are going to lose their employment or or have informal employments and don't have the money to survive. So the president has decided to take $3 billion out of the oil company, $700 million from pensions, and they're going to be distributed through different programs, Families in Action. They're going to be distributed into the economy so that people can have a safety net where they can fall on. And third, we have provided the president has decided that we're going to anybody 70 and older is going to be quarantined until May 30th. That the quarantine for everybody is going to go until the next 3 weeks. There's going to be relief in credits, which is very, very important. That was something that was agreed with the banks. And there's going to be lines of relief for small and medium enterprises, which are the ones that are going to suffer the most. Yeah. So this is a social issue, yeah. And I'm quite gladly surprised at how the Colombians have been taking it. It shows solidarity. It shows conscience. I was, to be very sincere, frankly surprised at all the people that came out here to see the cherry blossoms. I thought it was really...
I stayed home. I didn't go see the cherry blossoms.
I know, but did you see the pictures? They were crazy.
Yeah. Ambassador, thank you. And I want to pick up Ambassador Silva, and then I'm going to turn to you, Ambassador York. Ambassador Silva, similar question to you on efforts that President Piñera is taking to confront coronavirus. A number of very forward-leaning policies as well being taken in Chile. If you could reflect on some of the actions being taken by President Piñera, and also perhaps how that dovetails with some of the measures taken in El Salvador, as the foreign minister was describing, and in Colombia, as Ambassador Santos was describing.
Well, thank you very much, Jason. My greetings to all the members of the panel. It's a pleasure to be here today. And there is 3-4 dimensions that have been approached in Chile about this. As it was mentioned by Ambassador Santos, here is the crisis that is, of course, it's a health crisis and it has to be approached directly to that, but also it's a social and economic crisis and a security crisis at the end of the day. So we have 3 or 4 dimensions to approach, and of course there were steps being taken since the earliest stages of the disease when it was begun in China. So there was a committee that was established in January. There had been research being done. Kits for tests were prepared. We received from China the basic elements to provide our own kits. So in Chile, they're fabricating the kits in order to test people. And of course, in the matter of the health measures, we are in phase 4. As you mentioned, we have over 740 cases already, and only 2 people dead, basically because there's been a very well taken care of the public health situation. But in order to be prepared in that, for instance, there have been 37,000 beds in the hospital in Chile, and they've been increased to 42,000 now. 5 new hospitals that will be open. 1 of them already has been opened, and there is 6 posts of medical attention. And so far, the hospital ship has been deployed to move around the country. The coastline is a ship that is similar to the Comfort one that has been put in alert here in the United States. New ventilators have been acquired. They're already in service, around 2,500 ventilators nationwide, and we expect to have 4,000 by the end of this week. Several hotels have been also implemented in order to send people that is infected and cannot take their quarantine at home. Also, coupled to this is the influenza season coming to the southern hemisphere. So we are also vaccinating the people at risk. Half of the population at risk has been already vaccinated for influenza. And in March 20, we have not established yet a total quarantine of the country, but we have divided the country in zones, and we established custom borders, if you wish, to provide that only the people that has to transport supplies can reach some areas of the country, but the rest of the mobility has been blocked.
Ambassador, how's that being enforced?
Has been enforced in the airports, in the airports, and in the roads, and all the connections of the country. At 7 places where you, for instance, the reason is in the north of Chile there is only 7 cases. 3 provinces of Chile in the north have only 7 cases altogether. And in Santiago, we have over 80% of the 700 cases are in Santiago. So people is not being able to reach to the north. The same case in the south. In the southern areas in which you have very few people that have, so you have also custom borders that will, or immigration borders, which I don't know how to call it, which will provide with an environment in which they cannot reach and go across those borders to isolate those people that have not yet have the contamination established. There's also economic measures, as my colleague from Colombia said. This is also that will impact strongly the economic measures and the economy of the country. So the president has provided with a package of $11.8 billion to address the issue. 2% of the budget of health, the health system is being enhanced, and there's other measures taken into account, which there is an income bonus for people without pay. The people that cannot go to work and because of the coronavirus situation will receive their pays, and the contract will not be allowed to be broken, but they will maintain the salaries, and the government will help that with a fund that was created a long time ago for unemployment fund, which is taken out of salaries every single month. It's 2% of the salaries, and this has been taking place for several years. So the people will remain having their work and will continue to receive their salaries.
Ambassador Silva, that's a fantastic initial overview. I want to make sure to bring in Ambassador Yorka as well, and then we'll come back and have further commentary. And Ambassador Yorka, if you could, having you be the last first speaker, partly because you have such a background in the health space yourself. So if you could reflect on policies that are being implemented in Costa Rica, as well as what you've heard from the others.
Yes, well, thank you very much, Jason, for the invitation to the Atlantic Council, definitely, and to Adrian Arch for her support always. I want to say hello to, Her Excellency, the Minister of Foreign Affairs of El Salvador. It's a pleasure to share with you this panel and to be able to see at least on this, using this technology, to my friends, the Ambassador of Colombia, the Ambassador of Chile, that I can imagine where have you been here in DC the last couple of weeks. Well, I will agree with my colleagues that this is a mistake to only face this emergency from the technical epidemiological point of view. We have to approach to this challenge you are facing from different points of view and specialities like sociology. We have to take into account the culture of each country and also the resources they already have, or we already have, in our healthcare system. It doesn't matter if it is private or public, but we have to take into account all of this to be able to face this. It's true, Costa Rica has been doing, from my point of view, very well. We were able to take action very early in January, declaring green alert in the country, led by the president himself, and being able to bring a lot of different institutions from different sectors to the table to face this challenge. Of course, Costa Rica has a strong healthcare system. And it's already prepared to face this. We defined that a specific hospital was going to be prepared for facing only patients from this coronavirus, and we actually were trying to keep all the equipment necessary and the healthcare providers available to be able to face this. But at the same time, we didn't want to shut down the whole country. So we recently declared national emergency, but it was something to be able to take advantage from these facilities in terms of the budget that we are going to destinate to take care of this. And at the same time, we were able to bring not only public institutions, also the private sector to help us and to help us all facing this. So I don't think it's only a matter of a public health matter. It's a real political problem we are all need to face in different ways, each country their specific way.
Thank you. I want to, on your last point on the economic implications, and Ambassador Santos, Ambassador Silva, Ambassador Yorka, Minister Hill, all of you have talked about, started to touch a little bit on the economic implications. Mr. Hill, I'd like to go back to you, and this is a question I have for you. It's also a question that came in from one of the attendees joining. And I want to first acknowledge there's, I think, 250 people who are joining this video conference. I'm sure more will be afterwards. But Minister Hill, I think with the you mentioned the very extreme preventive measures that President Bukele has taken from the outset. And what are the concerns of the Salvador administration so far as the effects on the economy of such extreme preventive measures? What steps are being taken in El Salvador to try to mitigate some of the economic implications that are frankly implications that we're seeing in every country around the hemisphere? We're seeing it here in the United States, we're seeing around the world. What type of actions are being either taken or being considered to be taken from an economic standpoint?
I mean, President Bukele said it from the beginning, and this is going to take a big and huge economic toll, for our country. But as he stated it, he said, and this really touched my heart because I know who he was thinking about. He said, I would give everything I own, everything, to bring one of my dearest ones back home. So, the private enterprise is in this with us. The diplomatic community, international community is in this. Obviously, our frontiers are open for our goods because we import 60%, of our food and our imports. In spite of the efforts, we have designed, one person per family to go to the supermarket. Obviously, hospitals are open. Obviously, pharmacies are open. Obviously, supermarkets and markets are open. But the economic is going to be big, obviously. But as President Bukele says, I mean, we can recover this, and we will recover from this. But we cannot afford to lose our population. He has given the workers, I mean, he established economic cabinet of the government, and he proposed following measures to address the economic impact on the national emergency, right? And for example, he suspended the payment of electric, phone bill, internet bills for 3 months, and payments will be included in years. Also loans have been suspended for 3 months. So the people that cannot work will be given that benefit. Also, the collection of mortgage, personal credits, credit cards, working in entrepreneurship, capital and loans are frozen during the 3-month period without applying the penalties. Also, credit payments of commercial houses are suspended, and monthly rentals Monthly rentals are also suspended for 3 months, and an economic reactivation fund of $2 billion will be raised by the Legislative Assembly, which will implement projects and achieve measures of increase of 262 municipalities are ready with projects that are ready to be implemented. So to generate, that work that is lost, we are requesting all the mayors to join in this national emergency plan to reactivate this. The private sector has collaborated. It's incredible how people have turned to help the government, and they have helped with goods. They have helped with everything we need for the people that we have quarantined, approximately right now 2,000 in different quarantine spaces and places.
Thank you very much, Minister. I want to ask a similar economic question to the others, but I also want to maybe also throw in there also a question that I've been thinking about, and Ambassador Silva, you mentioned as well, the influenza season is coming to the Southern Hemisphere. And that's something that I've personally been very concerned about, while the United States and Europe are moving towards summer in the Southern Hemisphere. And I want to ask panelists if you believe that this is a question that came in via the chat. Do you believe that some of the tropical climates in parts of the Americas, is that less of a risk to the coronavirus? And also, what type of steps are being taken in the Southern Hemisphere? Additional concern that might be had because of the approaching winter.
Well, yes, well, exactly. Well, I was just looking at the question that we're getting in there, and it says, in South America, the tropical climate does help the coronavirus. Not all of South America is tropical. Argentina, Chile, part of Peru, and Uruguay, that do not have any tropical climate. We're Mediterranean. And we normally replicate the winters of Europe and the United States in our country. So the influenza is an issue, and every year we have to vaccinate everyone else. And normally we begin our vaccination season by April. But now, because of the coronavirus, the combination, and I would like to give the floor to my colleague from Costa Rica because he's a medical doctor, but I think that the combination of one thing with the other, if you bring both epidemic situations together, those people that are at risk will be much more at risk than they are now. So we have 8 million doses for people that are children, adults, and seniors, and people that are with conditions that will recommend to do so. And this is what we are doing. I mean, because I think if inflation is already a catastrophe in terms of
you're the medical.
goes together with inflation.
The question for you, Ambassador York, and then I want to go back to you, Ambassador Santos, as well on the economic question, but I also want to bring in a question for you, Ambassador Santos, on the many Venezuelan migrants and refugees in Colombia. Ambassador York.
Yes, that's a very good question. So I mean, well, in Costa Rican case, I mean, we have a very stable weather, but yes, we have our summertime and our winter time, and of course the amount of different infection diseases increase during this changing of season process. What is very important about this question is that we cannot forget the rest of the healthcare problems we already have, because it seems that in a lot of places we only talk about this healthcare problem called coronavirus, COVID-19, but we cannot forget, and I do agree with the Ambassador Silva, we have to still facing the rest of the flu infections we are going to face, definitely. So we should keep the vaccination, the usual vaccination programs we already have, and we cannot forget that we are going to still dealing with a lot of healthcare problems, maybe we may have the traffic road accidents being reduced because of these staying in home policies, and well, some other accidents, maybe labor accidents, because there's a lot of people working from home, or maybe those labor accidents will keep going on, but not at the usual working place, also at home. So we cannot forget about the rest of the healthcare problems we all need to have in our own country.
Ambassador Santos, Colombia's already faced a lot of strains on the national budget, given the incredibly receptive, welcoming policies of President Duque toward all the 2 million Venezuelan migrants and refugees that are in Colombia. Of course, very concerning for the number of migrants and refugees. Combine that with the spread of coronavirus and providing for those migrants and refugees, as well as the strains on the Colombian system, as with the Chilean and Costa Rican and Salvadoran systems and every country around the world right now. What are your thoughts? What are some actions that President Duque might be considering taking, specifically with regard to the large migrant and refugee population and the potential for coronavirus to more rapidly spread in some of the conditions in which those migrants and refugees live?
Yeah, I think that's the biggest issue that is different in Colombia than the rest of Latin America regarding coronavirus. And it's that the migration is creating a huge new problem in the health system of Colombia. With the destruction of the health system in Venezuela, we don't know what might happen. So that's a big question mark of what's going to happen. We have closed the border, but we know that people will come in through the non-legal ways into Colombia, because if you're facing death and you're facing lack of a health system, which they don't have, you're going to move to Colombia and say, I want to be treated there. So that will create complications. And I think that's something that for aid is going to be very necessary to look especially at Colombia and the migration situation. 1. 2, our budget for health, which is the biggest budget of our, the biggest part of our budget, it's already being strained, and that's why the money to attend this crisis has been gotten from another source of funding. That's why that $3.7 billion are coming from our oil sector and savings in the pension. Will that be enough? I don't know. Because as I spoke to one member of the central bank yesterday, he said to me, we are facing something without precedent in economic terms. The US, there's talk about unemployment of 30% in the US. What will that do to our economy? And we know that the recovery is going to be quick afterwards, but the impact is going to be quite dramatic. What the other element of it is, how do you get money to the informal part of the population that in Colombia is around 44% that have informal work. How are we going to put money in their hands? So that adds another part of the equation, is how to feed them in those 3 weeks where they're going to be interned in their houses. So the government has put Familias en Acción, which was a program that was very big. It had diminished dramatically, back into action, because it puts money into more than 3 million families in Colombia. The program of Adulto Mayor, that gives money to people 65 or over that are poverty lines or below poverty lines, is going to be increased and put money in those hands too. But again, the question is, will that be enough? We don't know. We don't know, because we're just seeing the beginning of the economic crisis. But certainly for Colombia, it's double because of the Venezuelan refugee crisis that we now have. And to be very sincere, the other day I was with one member here of the Health and Human Services, the guy in charge of the Western Hemisphere, And I told them, are you prepared if all of a sudden 500,000 Venezuelans move to the border because they're feeling really sick, which might happen? Are you prepared, if the world prepared for a catastrophe of those dimensions? And I said, can we build a hospital with 100,000 beds for a crisis of that dimension? It can happen. Hopefully it won't. But I think that's if something really critical is going to happen with this virus, it's going to come from Venezuela.
Yeah.
People are malnourished, really badly fed, no health system. And so I think the disaster that they created in that country is a brewing pot for big trouble.
No,
And
probably
I would put an eye on that area of the world for something that, and even go with the worst crisis scenario to do something evidently out of the box in case things go really wrong in that scenario.
Yeah, and I'll even add to that, Ambassador, that the numbers are completely unreliable out of Venezuela as well. They're, I think as of last night, new numbers came out of doubling that Maduro mentioned, but again, those numbers are very suspect. I want to go back. There are some questions over the chat, and I also had wanted to draw out, I think really important at this point, what we're trying to achieve here is also looking across countries and looking at what is working, what isn't working, and the opportunities for a regional approach. And Ambassador Silva, Chile, along with Colombia on this call, and a number of other countries are part of PROSUR, the Forum for the Progress of South America. And some initial encounters have been convened with PROSUR, and then I want to go to SICA as well. But starting with that, what type of opportunities do you see for cooperation at a regional level? Because I think one of the challenges that we've seen around the world thus far is a lack of coordination across borders. And when I look at what's happening in Latin America right now, I'm actually optimistic that there could be some real opportunities for coordination where many other countries in the world haven't yet done so. Ambassador Silva, could you talk a little bit about what you're seeing insofar as the regional approach, and then we'll move to Ambassador Yorka, Minister Hill, to talk about Central America.
Thank you, Jason. Yes, actually, a few days back, in March 16, there was a non-presidential video conference of the Ministers of Foreign Affairs, Minister of Health and Economy in PROSUR. We don't know what CELAC has been doing. We haven't heard anything of that integration system. But in the case of PROSUR, at that level, the minister met virtually, and they shared their experience. The first thing they did, they talked about whatever was happening in their countries, what the measures were taking in order to share experiences and understanding of the crisis. Also, they created a plan and policies to allow nationals of the group of safe and speedy return to their homes, because the mobility in between Chile, Peru, Argentina, Bolivia, and so on is huge. So there was a lot of people, and it was holiday season as well. There was a lot of seasonal change in the country. So we had to find out a way in order to prevent those people being stranded in different countries for a long time. Then they share information, daily information regarding measures that would impact the movements of people, how it was working. Then they tried to also share information about policies and campaign, how to stop spreading the virus. Some decided to lock down the country itself completely and establish quarantine, obligatory quarantine. In our case, it's been different. We have applying measures step by step. We will probably get to quarantine, but as I mentioned before, we have established different zones, different areas, different measures. We have coordinated also the way we will get medical supplies and for all countries perhaps together and work with PAHO on this matter, and as well coordinate how we can reach to regional financial institutions to support the efforts that are being made not only in matters of health, as we mentioned before, but also in regarding the economic and social pressure that will come from this pandemic. That's about it.
Ambassador, thank you very much, Ambassador Silva. Ambassador York, I'll ask Minister Hill as well to comment on the degree of cooperation in Central America. We've already seen through SICA some efforts being taken.
Yes, exactly. We have to recognize the leadership of the secretary, former president of Guatemala, so of calling all the SICA members, countries of Central America. I have to point it out that also Dominican Republic is a member, and also Belize, but we've been trying to keep the borders open. We know that there's trade is very important to be able to keep enough to be able to supply goods enough to the population. We need, for example, we have a specific agreements in Central America, and we want to keep those agreements going on, but it's very hard on this situation. We already reduce the amount of flights we are receiving from abroad. We are trying to receive only people from Costa Ricans that were traveling around the world that are coming back to the country. And we have to recognize that it's hard to control our borders, both with Panama and with Nicaragua. And we have a long history of receiving migration from both across both borders, and we recognize that it's going to be hard to control and to stop all of this migration to continue going on. But of course, we are trying to improve the level of supervision we have there. And of course, we are trying to also to identify suspect cases and to do the test on our borders as far as we can. I mean, Costa Rica haven't really shut down the country. We are still we already closed bars, casinos, discotheques. We already are avoiding massive events to happen, but we are keeping, for example, restaurants, local small restaurants going on, but they have to be aware that the only to be able to complete 50% of their capacity, and at the same time taking into account the social distance and the distance between tables and between seats on the places. I mean, migration, it's always a special situation we've been dealing with in Costa Rica since a very long time ago, and we know we will continue facing that as a reality for sure, definitely.
Thank you, Ambassador. Mr. Hill, I want to go to you on a similar question insofar as cooperation and what you see as opportunities for regional cooperation at this critical level. And maybe even as part of that question, Minister, what you're seeing as lessons from other parts of the world that you see is working, that El Salvador has been deploying, and things that you're potentially thinking about further doing from the Kelly government.
Right. Well, I have to agree with the ambassador of Costa Rica. We have to take a multidimensional approach to this unknown issue or crisis. I mean, it's not only a health approach, but an economic approach, a political approach. But in either case, in the case of El Salvador, because of our high density population rates and our precarious health system, our measures have to be preventive and they have to be extreme. That doesn't mean that we have been, I have been in constant contact with the foreign ministers of Honduras, of Nicaragua talking to SICA in order to facilitate, the measures that we take at our borders. I mean, our borders are not closed. I mean, it's business as usual, even though the people that transport, for example, vegetables from Honduras, we are not allowing 20 people to go in the truck. I mean, the truck driver has to wear a mask, and there are Salvadorian people with all the health preventive measures that help them download their merchandise. We are also cooperating in every single finding or measure that we take. For example, we are not forgetting, even though we have a precarious health system, we are not forgetting or throwing out our patients that have either respiratory, cardiac, renal problems, or births. No. We are still attending those populations. So President Bukele has made the decision to build the largest hospital in Latin America to attend the pandemic, with a capacity of 2,000 beds and 300 intensive care units, to be used exclusively for patients suffering from this virus. I mean, it will cost us $70 million, and we have already, with the Minister of Finance, made the arrangements, and the building of the hospital is undergoing. But going back to the cooperation issues, even though our countries' realities are different and we have different, strengths, like, for example, Costa Rica has a very well organized health system. We don't have the answers. We don't have all the answers. So open communication, open cooperation, findings, policy, and campaigns are of great use for all of our countries. I mean, every measure that we take that seems, I mean, for now at least, successful, will help, diminish the peak of the curve, which would collapse our health system. So social isolation is a must for us. It might not be the reality for other countries, but for us is the best measure that the president has taken to contain, the spreading of the coronavirus. We have only 3 confirmed cases right now, but we are not. We are not letting our guard down because we are positive. Now, I was reading in the New York Times that now, it was China, Italy, and now New York City is like the epicenter of the pandemic. So no one can guarantee us that it's not going to hit us.
Yeah.
So
I think there's a similar story. One of the attendees brought this up in the chat about the fact that also young people who with no underlying health problems have also ended up in intensive care. I want to make sure that we're ending relatively on time. There's a comment here from Christy Palakia from the U.S. Development Finance Corporation, who just wants to reiterate that the U.S. DFC stands ready to help with the response across the region. I have a last question to each one of the panelists, a short question, 30-second response. I'll start with you, Minister Hill. What is the one thing that we should be paying attention to that we haven't yet talked about, or looking around the corner that we should be anticipating or thinking about as a possibility that should be more front and center on people's radar screens right now?
Well,
Quick response. I'll start with Minister Hill.
sorry, sir, I could not hear your question. Could you please repeat it?
What's the one thing, looking around the corner or looking 5-6 months down the road, that we should be paying attention to that we're not focusing on right now?
Well, what we focused from day one, and I have to say that, when I look at my president, and when I listen to my president, and when I work with my president, I just think of the Theodore Roosevelt, the speech that he gave in France in 1910 that was called, citizenship in a republic. It's the man in the arena. My president is the man in the arena. And as he said, we are taking measures, sometimes very fast measures that we have to see whether they're work, whether we have to change them. But the worst thing that we can do is just, get paralyzed and say, oh no, it's not going to hit us as hard, or it's not going to hit us. We all have to sacrifice ourselves. And again, for me, social isolation is the best measure that we can take. And I hope and I pray to God, and we all pray, that in 5 or 6 months, this nightmare will be over. Now, we cannot foresee the level of devastation, economic, social, health, human devastation that it's going to take. And I think that we really have to start thinking down the road, okay, these are the different scenarios that we're going to be in within the next 5-6 months. And this is the measures that we're going to start taking from now to be able to recover what we've lost.
Thank you very much, Minister. Ambassador Santos, what's one thing that we should be paying attention to that we're not focusing on quite?
Very shortly, I wouldn't say it's one. It's a few of them. One, we need to learn from our lessons. This is something nobody was prepared for. And I think it's very important to start getting the information of what we did right, what we did wrong, what the world can do in the future. Learn from Korea and China and Japan, where they used apps to get information on people, etc. How do we prepare for the next one, which I think it's going to come?
Yeah.
Second, how are we going to recuperate our economy? That's going to be a critical issue in the next year and a half. Third, how do we strengthen the WHO and PAHO in the case of Latin America? Because I think they were very important, but are weak in terms of the delivery of a lot of the things that especially countries that are not as prepared need. And fourth, how is this going to affect the supply chains in the world, which I think are going to, the commerce that we used to have in the last decade is going to be gone. And I think there's going to be a reaccommodation of supply chains that is going to become important. How does Latin American countries play in that reshuffling is going to become a big discussion in the next years.
Thanks, Ambassador Santos. Ambassador Yorca, I'll go to you, then Ambassador Silva, you'll have the final word here. Ambassador Yorca. Your microphone's, there you go.
Okay, no, I believe that definitely we are trying to do our best in Costa Rica. It's impossible to say that the Costa Rican way of doing it is the way that some other countries should, because each country has different conditions, resources, specific situations that they will have to deal with. Costa Rica, for example, doesn't got army. It's something very special. We have to convince the society of doing what they are actually doing. I mean, it's a matter of day-to-day repeating the same message, and of course, again, we cannot forget the rest of the areas of the economy. That's why most of our governments, the government of Costa Rica already defined electricity payments to reduce the sector, trying